Injury treatments. What is an injury? An injury is a general term that refers to any type of damage to your body caused by external factors. There are two types of treatments: cold treatment, cryotherapy, or heat treatment, thermotherapy. Cold treatments reduces blood flow to an injured area. This slows the rate of inflammation, and it also numbs sore tissues and slows down the pain messages from being transmitted to the brain. Ice can help treat a swollen and inflamed joint or muscle. Types of cryotherapy: a cold compress or a chemical cold pack applied to the inflamed area for 20 minutes every 4 to 6 hours for 3 days, immersion or soaking in cold water but not freezing water, massaging the area with an ice cube or ice pack in a circular motion from 2 to 5 times a day. When applying ice directly to the skin on the back, be sure to keep the ice moving in a slow circular motion to avoid staying on one place for too long. Limit the ice massage to no more than 5 minutes at a time, and be sure not to fall asleep with the ice resting on the skin. Ice application of any kind should be avoided by patients with certain medical conditions. Cold treatments should be used for osteoarthritis, a recent injury, gout, strains, tendonitis or irritation in the tendons, and migraines. Cold application is commonly used before strenuous exercise due to its hypoalgesic effects. Hypoalgesic means a decreased sensitivity to painful stimuli. Some have questioned this procedure because of reports that cold may reduce isokinetic torque. Isokinetic muscle strength is generally described in units such as peak torque or peak force. The intent of evaluating isokinetic strength is to determine the work capacity of a muscle group or the ability to produce force as well as the balance ratio of opposing muscle groups, for example, flexion and extension. The physiological effects of cold therapy include reduction in pain, blood flow, edema, inflammation, muscle spasm, and metabolic demand. For immediate care of soft tissue injuries, which is the damage of muscles, ligaments, and tendons throughout the body, the reduction of tissue metabolism by cooling is more important than the reduction of blood supply. This cooling effect was first used in a trauma surgery in the 1950s. In this surgery, the patient's myofilaments were severely damaged only 2 hours after the accident occurred. This may have been caused by hypercontraction of peripheral muscle cells prior to the accident. There was cellular damage and myocyte death due to the lack of oxygen to muscles.